Our next video starts with skill 3, and that is to set up the Servo-U in volume control. So we touch all of our modes and then touch volume control. All of our settings come up there. It asks for a 21% PIPA 5. So let's go down to 5. And then our next one is tidal volume of 450. And a respiratory rate of 12. And then an eye time, we'll leave eye time for the last. Pause of 0, which we have. A rise of, inspiratory rise of 0.15, that's good. And initially set the flow trigger to 1. So that's what we will do. Okay. Now, the last thing it says is to adjust the eye time to get a flow of 30 liters per minute. So you can see right here is flow. Right now it's 29.2. So let's see. If we go 29.2, 30.9, either one is okay. You can see we're almost identically split between the two. So I'm going to leave it with an eye time of 1 second. I'm going to be 0.8 below instead of 0.9 above. So remember, these are trying to get approximate. So 30 liters a minute, hit accept, and now everything is done for that initial setup. So I'm going to hit accept. That accepts all of those settings. All right. And then I'm going to go and hit start ventilation. Don't connect your ventilator until you have everything set appropriately, okay? We don't want to put the patient on the ventilator and then end up with all kinds of problems. So we may want to just touch our alarms first and make sure that we have reasonably set alarms. So our high peak pressure at 40 is a good place to start when we don't know what else is happening. We have a PIPA 5, so I'm going to put it at 3 for the low, and the high I'm going to put it 2 above as well, so that'll put it to 7. And so now we've got our high and low set, and that's very reasonable. We are guaranteeing them 12 breaths a minute, so we want to set that maybe to 10. We know we're going to get at least 12, that's guaranteed. And then a high of 30 might be okay. We might want to come down a little bit, maybe to 25, but either one of those would be okay. And then lastly, we're at minute ventilation. So minute ventilation, usually the way you want to set it, the book says 2 to 5, that's Egan's, which is our Bible, and we can't kill you for that. But it also says or 10 to 15% below, which is about 1 liter. And so we're on 12 and 450. So a low, this is showing a low, it's 10% below. That's not bad. We could go a little lower if you want, but I'd be happy either way at 5 or 4.5. Our upper should definitely not be up to 40. That's crazy. We might go the 5 above in this case because we're okay if the patient takes a few extra breaths. So maybe we're down around 10.5 or 11 liters, and that would be good. And that meets the criteria for Egan's. Okay, so now we're ready to start. I hit start ventilation, and now I connect my patient, and we are ready to go.